Welcome back to SheCan, where women role models lead by example by telling their stories, because it's easier to be what you can see. Please subscribe if you enjoy our content. Subscribe to our YouTube channel. You do us such a favor. And I'm excited to talk to Adeshola Akanji this morning. Adeshola, welcome to SheCan. You're a project manager within the NHS here in England. That's our National Health Service. You volunteer as co-chair of the Disability Network. You're a Wellbeing Champion and Inclusion Ambassador, advocating for equitable hiring, inclusive workplaces, and the well-being of staff and patients with long-term and hidden disabilities. You're a member of the Disability Pioneer Supergroup in collaboration with NHS employees. You write about health and well-being and disability, and you are super honored to be nominated for the Barts Heroes Award. You're a freelance speaker and consultant as a disability advocate, empowering individuals with long-term health conditions and disabilities to embrace their identities, access essential resources to thrive personally and professionally. Adeshola, thank you so much. You got in contact with us. We're delighted to hear your story. So tell us a bit more about yourself and how you feel you got to where you are today.
Thank you so much for having me. So for me, my story, I've been someone, I graduated in Biomedical Science from London Metropolitan University. And at the time, I was pregnant with my son. And through that period, it was quite difficult. I had my brother's support for a time, a family member just coming. So it's been me as a single mom raising my son, who is now 22 years old. I'm proud to say, and an amazing young man. And through that journey, I think for me, again, being an introverted person, it was quite difficult to be able to manage through completing my degree, which, of course, at the time, my family and from my culture, one of the concerns is when you are pregnant while in school or in uni, that might just put an end to that education, and which is quite difficult, especially for my parents. But I was able to complete my biomedical science degree, which they were so proud and so happy to be here, came to my graduation. Going through that journey, again, brought me into trying to understand better perspective of other people as well, in terms of how they're managing through difficulties and challenges in life. And then I started in the NHS. First of all, I was doing a work placement during the time I was in the university, which then led to me getting a job within that hospital, Royal Free Hospital. So being introverted, I think I was so comfortable it was just my comfort zone and didn't want to do much. And then it was later and someone mentioned, you can apply for a more senior position, a team leader position. I thought, I'm not very sure about that. And so that started my leadership journey, applying for leadership role, team leader role, and then going on into now being a project manager. And for me, I think what really made my journey more impactful was the fact that during my life period, I had several long-term health conditions and disabilities. And that, of course, was quite challenging. Initially, a lot of my health conditions started when I was made homeless due to the landlord not paying the mortgage while I was paying the rent. And that I ended up in the council accommodation, which was not very comfortable, had my first panic attack there. Because of that led to other health conditions just simultaneously. And before I knew it became such a difficult to manage chronic fatigue, fibromyalgia, and you can imagine different other conditions. Balance disorder. I think the first time I had the balance disorder, and I went for physiotherapy and I saw more elderly people within that. I went to pick up my son, sat in the park next to the school, and I cried. And I thought, at my age, a very young age, in my early 30s, been diagnosed with a balance disorder, and it was just elderly people with me. So, of course, you can imagine how that was impacting on my mental health as well. So, which, again, I was diagnosed with comorbid mental health conditions. So, and on, and then within the last year, actually less than a year, I got my diagnosis for autism, ADHD, and dyslexia. So for me, having gone through what I've been through, and a couple of years ago being in ICU, ended up in ICU for a surgery that was meant to be a routine surgery and went wrong, it changed perspectives for me. My mom said to me, "Don't let anything stress you out anymore. You almost died." That was a wake-up call for me. Because of the wonderful people in the ICU, that made me want to give back. And then one of the things I started was volunteering for the Disability Network in my organization as one of the site leads at the time. And because they were happy with a lot of the work I was doing to promote disability, especially in disability, then got into the role as they asked me to apply for the group co-chair role, and I applied for it. And that's been a lot of my journey, which led to a lot of public speaking, led to me being an advocate and consultant of disability and supporting and empowering other women as well as introverted leaders, and being in a lot of conferences and summits and different webinars as well, and working with other organizations.
Adeshola, thank you so much for telling us all those details. And we understand at SheCan that authentic stories need to be told vulnerably, and we're always thankful for that. Adeshola, what do you feel are your sort of main learnings, the takeaways that you can tell us from living your own disabilities and showing up in a workplace with those every day, and also working in disability advocacy?
So for me, one of my learnings is there's still not enough disability awareness, I would say. So it means having to constantly try to advocate for disability, because the awareness is not there, it's really low. Again, not having enough senior leadership support of role models, because I feel it comes to a point as senior leaders, nobody wants to talk about their disability. And I can understand sometimes the fear of discrimination, harassment can be a subject, a part of it. And having been someone as well that's gone through in employment, gone through bullying and discrimination and harassment, and I can understand from that perspective it can be difficult. So it's just trying to promote more in terms of helping them to understand lived experiences are powerful and impactful to support other people. One of the other things, again, that I learned as part of my journey is disability can be acquired at any point in our lives. 80% of disability are not disabilities that people are born with. People don't realize that they acquire disability. And that's one of the things that I continue to advocate for people to have accessibility in place, all the accessible things in place, resources and support channels in place to support people, because it could happen at any point, even if not to them, to their family members. And in another area as well is trying to understand it's important to advocate for ourselves, because through my journey, my advocacy work has led to me advocating strongly for myself as well, to be able to get the resources and support put in place to help me at work, which was I came about access to work through my research. I didn't know about it. Nobody told me about it. At the time, I was signed off sick due to be harassment and bullying from one of the managers. So that led me to find out more about what can I do to support myself. And in turn, knowing that, it's helped me as well to start using that to support other people and help them and directing them to the resources and support they need. One of the other lessons for me that I think is so powerful is people feel, I don't think I can make any impact in other people's life, or any significant impact. And I say, start small. I always say that in my talks, start small. No amount of impact you make in people's life is small. It could be that small act of kindness that could be a bigger ripple. And I always say one of the things I do as well in terms of that is mentoring and coaching. Mentoring people is a volunteer role that I do. I don't get paid for it, but it has led to developing a lot of people, especially women, who felt, oh, I can go further. Even men. One of my examples was a man that felt, a colleague who thought, I'm not sure about applying for that higher role. Again, the comfort zone. But my teaching was, why not? It is a way for you to develop yourself. It is an opportunity, and it's the role that you really wanted. So I coached him and was able to go for that role, and he got the role. And I thought, yeah, for me, that was key. And I've coached and mentored a lot of women as well in helping them to reach out, to get out of their comfort zone. An example of them is I've learned from people being a role model for them and enable them as well to put themselves out there and be site lead like myself in the Disability Network. I've had a lot of people now join the network as a result of me supporting and mentoring them, and they wanted to give back as well. I think a lesson for all of us in a whole is any accessibility that we put in place for people with disability or with disabled people is accessibility for all. It
Yeah.
means we can have a better world for everyone to live in and to thrive and be the best. It can be the opportunity for everyone to grow as well, to have that sense of belonging and be able to feel more confident in themselves, feel empowered, even if it's not to support themselves, to support family members at home. It doesn't always have to be even just at work, or to be able to support other colleagues in making sure they have that equitable recruitment process, equitable workplace where they feel well supported. And I think it's important. For me, overall, research has been key. And I think I always tell people as well, and I say to them, research is so powerful. It's important for you to research things. You can't wait for people to tell you or people to feed you everything. We need to research ourselves, find out more about what can I do to better myself? What can I do to improve my working life? What can I do to improve my personal life? Which has led me to a lot of research, which I'm now also being able to share with other people.
Adeshola, I understand that the NHS is a massive organization. And of course, we need all these networks in place, the disability network, to make the workplace more easier or possible for people with disabilities. And given that people acquire disabilities predominantly throughout their life and most of them are invisible, how do you feel we can all be more aware and supportive as a society? So not just in a workplace, but as a society, how can we each be more aware and support people with all these unseen disabilities?
What I find quite important is be curious. People need to be more curious about disability. And I think promoting disability as well in terms of having people with lived experience, because I can say, there's no conversation about us without us.
Yeah.
It's not just in the workplace, outside the workplace as well. And then changing perspectives of disability in the community. I know a lot of the times we talk about disability, but what we want to know is what action are people taking, even if we do disability training, disability awareness. Is it something they just listen to after they finish, tune out, and that's it? And that's what we get a lot of that happening. So I feel it's doing a lot more campaigns about disability. And part of the campaigns I've been so proud to be part of was the autism during the World Autism Acceptance. It's just saying, what does autism look like? And that's one of the things as well, because people feel autism is a particular look, or people with autism a particular way. But helping them to understand is a spectrum, and any of us can fall within any level of the spectrum. And I think education, being able to provide education, I think a local level is so important. If we're doing a lot of education, re-education as well, because things change all the time in terms of disability, in terms of language as well, of disability, it changes all the time. So it's important to keep in line with the times, to make sure that we're aligning with our values, with our core values, is that treating people with kindness, understanding disability, understanding where to get resources and support for people with disability. Again, helping people to feel empowered to come out and to speak about their disability without fear of shame, bias, or discrimination. If we can do that, and also supporting carers. I think one of the things we do is we ignore carers sometimes. We feel, well, it's not important. But for me, one of the things I do at the moment is the podcast that I'm doing is helping family members, carers, colleagues with disability, even colleagues without disability, but support disability, to talk about their experiences, about the resources, the support, the challenges, the barriers, and help other people to learn from it. And I think we need more podcasts like that as well, that are true and genuine, authentic people talking about their experiences, their vulnerability. I think if we can share our vulnerability, then it's key that people will learn from that. there are a lot of disability advocacy work, and I think helping organizations as well that support disability or that doesn't support disability, because they will have people that are disabled within their employment, as the staffing. And I think in all community libraries, there should be a source of support for people with disability or carers or family members. There should be a lot of information channels in different areas where people can reach out. But I think it comes from people really understanding disability, because if they do not understand disability, the impact of how disability is on people's lives, it won't make them want to do anything or change anything. And that's why I think once we can get people to have that lived experience, learn from people with disability, ask them to take action, the ownership, and what action are you going to take from learning about this? And I would say there's one of the training, the Oliver McGowan training that is, the people are doing to help them know more about neurodiversity. And I asked the question, when you completed a training, was it a teamwork exercise for you? Did you learn anything from me? And people think, I just wanted to complete my statutory mandatory training. That was it. And I said, oh, okay. So we're not really making that impact then. We need to change something. Even when my son completed it, and I said, okay, did you learn from me? What did you learn from me? And how can you support people with disability? So we need to ask those questions.
Adeshola, and I love you lead with your story, right? And this is exactly how you change and support people who have disabilities or other disabilities. And I couldn't agree more. That's what we do at SheCan. We hear all the stories to then guide others, and all the stories give you so much insight to someone's lived experience, and that changes a narrative. Adeshola, so you're obviously a disability advocate. You lead with your story. What type of a leader are you, and do you want to be?
For me, I always say I strive to be a leader that's compassionate, kind leader, a leader that looks at everyone as an individual. I can change my sort of leadership skills or a leadership style depending on individual person. So I do not put myself as a particular sort of leader, because I learn to be adaptable. I learn to be fluid, to change according to the needs of the individuals. So I could put on my mentoring cap, I could put on my coaching cap, depending on the needs of the person. And one of the things, again, I strive to be a role model for other people, someone they can lean on, someone they can learn from, someone they can come to if they need support, which is an example of having a colleague that lost a family member. And one of the things is I had to advocate for her, because at the time she was being signed off, of course, because of the grievance. And the next thing was she was trying to take some additional time off from her annual leave, which I felt was great. I didn't have any problem with that. But my senior leaders felt, no, she should come back. But I explained, this person, the family member died on the same floor. The ward where they died was on the same floor where she worked. And I thought, we need to be more compassionate as leaders. We need to support them. And I took it upon myself to speak to HR, and HR agreed with me. And I said, well, that's it. HR has agreed. We're giving her the time to support her, and then offering the person as well. Do you prefer to work in a different office? We need to change our style. We need to change our approaches. We need to think about the person and put ourselves in their shoes. What I do, and again, having that, my disability background, is putting myself in other people's shoes, being empathetic with them, and be quite understanding, listening to them. Sometimes they don't need you to talk. They just need you to listen. What I did was outside that, the person didn't want to be within the organization at the time, because they're worried about how people, the kind of questions and making them feel uncomfortable. I took time out to go and meet them outside in a cafe. There's some little changes, little things we can do just to make sure that we're supporting ourselves. And again, for my sort of leadership, I do believe that learning more about my colleagues, learning about them individually, of course, what they're happy to share, because you don't want to pry. We need to make sure that to that level they're comfortable to share with me. And when they feel that they can trust you, that they can share with you. Because when I share from my story, it helped them to know that they can trust me. And one of it was, again, when I was part of a panel from the Schwartz round, of course, I shared my vulnerability, help other people and think, oh, I can resonate with that. And that's one of the reasons why this particular person was able to share with me, because she attended the Schwartz round. And I think if we are able to show our vulnerability and authenticity more as a leader, if we're able to show that we're not above everyone else, that we are very understanding, we're empathetic, we are very caring, and we want to support them, because they need to genuinely know that we want to support them. Otherwise, of course, they're shut down. And being able to know as well that they can be confident that whatever they discuss with me, of course, I will keep confidential. And I think that is key as well, because the last thing anyone needs is having a conversation with you and the whole HR, the whole everyone else knows all about it. So that has kept me going in my leadership and been able to support other people. And I do want the best for my colleagues, want the best for everyone. And I think that shows in the way I treat them as well, because I want the best. I want them to thrive. I want them to be empowered. And that's, for me, it is key. And that's why I achieved what I achieved today.
Adeshola, it's palpable how you care, how you share not only your story, but your insights and experiences and all the services that you were able to access to share that with others. And it's also about daring, because you dare to use your voice for disability, people with disabilities. What does success look like for you? What does it mean for you?
I think success for me is when I'm able to reach people globally and helping them to have a better understanding of disability. Success for me is when I can impact people's lives in such a way that I can see that it's made a great difference in their lives. But not just that, they've also been able to make a difference in other people's lives, because I believe in that chain of reaction. So for me, success is when we can support each other, help each other, so that there is that chain of connection. We have that community spirit where everyone feel empowered. I know there's still a long way to go, but I'm on that journey to ensuring that we have more people feel empowered. Even again, I will pull from my not just disability. As an introverted leader, as I said, I'm very introverted. A lot of people don't believe that. And then when I just a couple of weeks ago, and my speaking engagement was regarding thriving as an introverted leader. And it was amazing how people thought, oh, goodness me, that's true. These are things that I can connect with. And it's just, as an introverted leader, we're not limited. There's still so much we can do as well, getting them to feel that empowered. So it helps me to be able to connect to many people. And I think success is always a world where people with disability feel heard, feel that they can, share, they have a voice, and they feel that confident to be able to talk without that bias, discrimination, and feeling of harassment within the working environment and outside that. Again, success for me is where community can be more acceptance of disability, looks at disability not as something to feel stigmatized about, but disability is that we are just, everyone with a disability is a normal individual. We are the same. Having a disability does not limit someone's ability to perform or be their best or to thrive or be successful in their lives as well. And I think people look at disability and say, it means they don't have the capability, or it means that they don't have, they don't look at the strengths they can bring into different things. There are strengths connected with disability. I know I don't always agree with superpower, because not everyone feels the superpower. A lot of people still worry that their disability is debilitating and they don't see the joy in it. But some other people can, embrace their disability and say, of course, I feel my disability is a superpower. So we need to try and tailor it to individual person. Ask people how they would like their disability to be addressed, but the language as well is so important. So if you can have that better understanding of languages, there's some languages now that we need, obsolete. You can't use them anymore. So we need to learn if we don't know. And again, when you hear people say, oh, you don't look disabled, especially hidden disabilities, and that's why the powerful raising of disability awareness for people with hidden disability. I hear people come to me and say, oh, you don't look disabled, or say to me, instead, you're just making it up. And my heart crushes, because these people are struggling. I'm struggling. A lot of my disabilities are invisible, a hidden disability. And for me, I think for us to achieve that success, we need to make sure we are empowering people. We're educating people. Oh, we're helping people as well to be more involved in research as well, and understanding of what disability is, of how we can have a better society where everyone feels empowered, everyone strives. And for disability, people with disability don't have to feel that every time, they're sharing their stories, just making them, another number, tick box exercise with just an organization for us to have a disabled person come and share their story. No, we need to make sure that they feel that they've said has been heard and it's been taken into account, and there's action at the end of it as well. What are we doing to change things? If we can make those changes and make people with disability feel more empowered, feel more happier, feel more sense of belonging, I think for me that is a great success worth having.
Adeshola, you said so many important things. I think the important thing is that the words and the language that we use around disability, but really all the different facets of areas of life that we need to improve, I think is very important. And I feel that the more we talk about it and the more we are led by people with disabilities to learn how to frame it, how we can help to change the narrative. Because the one thing that we all know is the more people thrive, the better we are as a society, as an economy, as a country. And so I think the listen and the learning is what we need to embrace more, because we are quick to judge, and we teach children and don't teach them to be curious rather than judgmental. And I think we also feel often uncomfortable when people are different, right? Because somehow it scares us. It scares us as people. So if we can embrace this shared humanity and be curious about other people's experiences and lives as a whole, we would make such a difference here. Adeshola, you work within the NHS. It's a mammoth organization. It's an amazing organization. It's in the headlines all the time in the UK now because a lot of things in the NHS don't work. But when I listen to you, I think there is many areas of the NHS that do work, because they are a really inclusive workplace. And there is a lot of incredible people, and you're not the first one I interview that works within the NHS that makes such a huge difference. Tell us a little bit about that lived experience you have working within the NHS, championing for the things that really matter to you.
Yeah, so for me, working in the NHS, the things that is enabled me to do is work with colleagues that, people with the same lived experience as myself, being able to understand the challenges and barriers that we're all facing within the organization, within the NHS, because if you speak to several NHS organizations, they are all facing the same issues, and especially we know with the financial issues at the moment within the NHS. So looking at how we can work together with what we've got. And I think it starts from my journey. I've been in the NHS for over 16 years. What I've learned is within the NHS, we have so many networks that can support us. And one of my, the disability network is one of it. One of the things we've been able to do within the network is the disability policy. And I think my sharing from my organization is enabled because I meet with other NHS organizations and networks as well. And one of the things is sharing that experience with one another, sharing resources to support one another, because of course we are one big NHS. So for me, I think when we looked at our policies and realized there wasn't a standalone disability policy, that triggered something, and we felt, what can we do to improve that? So that led us to the drafting a new disability policy, because when we started working on reasonable adjustment SOP, as standard operating procedure for staff members, we realized we need to still go back to disability policy, which we didn't have. So that delayed a lot of things. With this disability policy, it enables staff members to be able to know the areas of support resources that they can acquire or get within the NHS, and then learning about what the NHS, for my organization, they have the funding for people that require reasonable adjustment. there's still always that language as well. What is reasonable adjustment? And I know it's managers' discretion, but then helping the managers, and that's one of the things, is having disability awareness training for managers. So one of the things we're doing is neurodiversity awareness training, disability training for the managers so that they can have better understanding of it, and helping managers, supporting them as well. One of the great things we've designed is we call it disability passport. We call it BartsAbility passport because of our BartsAbility network. So the disability passport is enabling people to show their strengths. It's not just about telling them about, telling people, their managers, about their disability or long-term health conditions. It's about sharing what their strengths are, what are the challenges, what can they do to be able to, what support they need to be able to manage those challenges more effectively. And part of the story as well is meeting with other NHS organisations. I was privileged to be part of the Disability Summit 2025, talking about equity in recruitment. What can we do to improve my recruitment process? I think for NHS, we're always learning, and it's so powerful to learn from one another. So through one of my advocacy work is talking more about disability in the sense that what can we do as organisations, as big organisations, to change that? And it led me to just recently as well, making changes in the eating disorder service, because with the eating disorder service is a one size fits all. And as I said before, there is no one size fits all. So one of the things I was being able to discuss with the head of the service, and it was just amazing to realize there's so much they could be doing, so much more they could be doing, which led them to go in, and he said to me, you know what, we sent our staff on training. I thought, oh, great, I made an impact somewhere. And the next thing was they changing the way they manage the eating disorder for people with autism, because there's something called autism eating pattern, which people don't factor. And this one of the learnings that we get to learn this, and we get to share the learning, and that, of course, we're improving the lives of our patients and staff. And so patient safety, patient care is priority. And we can all be patients in the NHS. I'm a patient in the NHS as much as a staff member as well. Again, within the NHS is supporting our staff through the networks and through other avenues that we can. So we have speakers coming to the organisation as well to share their lived experience, as we said. One of the things I champion is to have senior leadership representation in a lot of our events, because that way people can feel more confident. They're hearing a senior leader talking about their vulnerability and their authenticity, about how they manage their disability. I think that is so powerful. People don't realize that. Then they feel confident that, okay, if a senior leader is sharing, then of course, and that's what we have, the Safe to Share campaign, which enables staff members to be able to share about their disability and feel more confident as well to talk about their disability without fear or stigma. So there's so much.
Adeshola, I can see that, and I find it fascinating, and I'm so happy to hear it, because I think the NHS gets such a bad rep lately. And I'm sure there's a lot of things in terms of the overall management of the NHS that needs to be brought in line, but I feel that it's an incredibly human place with incredibly powerful and impactful people sharing their journeys and making the journeys for others better, because we all know that once staff is happy, patients are safe and happy. And I think that's the most important thing. So what are you most proud of to date, Adeshola?
What I'm most proud of today is the impact I've been privileged to have in the lives of other people. And I think if I didn't have my disability journey and then get to share my disability journey and feel proud about my disability and empowers me. And for me, one of the sayings I always say is my disability is no reflection of my worth, rather it highlights my authenticity and individuality. And I tell people the same as well. So part of this impact, as I say, I'm so proud that I've been able to change a lot of people's lives positively. I've been able to support people to access support they need, to access resources that they wouldn't have thought of. Because when I do some of my speaking engagement and I say to people, do you know it's legally, organizations have that legal obligation to provide a support for you because it's part of the law, and they say, oh, we didn't realize that. And then you ask them as well, do you know about access to work and the support you can get from access to work? And part of it as well is I learned that a lot of people still worry that without a diagnosis, they can't get support. And I tell them that's wrong. And that's one of the things in our policy, disability policies, to tell people you don't need to have the diagnosis. As long as you have the challenges, you can show the challenges you're facing and what you would need, or your manager can look with you, or even outside work as well. You can look at what support, go to Access to Work, ask other organizations as well. It's not just Access to Work. There are things like Exceptional Individuals and many other organizations that support disability, Scope, for example, as well. Talk to them and find out, what can I do? These are the challenges I'm facing at work. What can I do? Which organization can I reach out to get support? When I start talking to people and say, do you know you can reach out to this organization, reach out to this organization, they're just amazed, because they feel, I've been suffering for so long, not realizing I could get support. Some of the support, don't cost a thing. Sometimes it's just flexibility around how they manage things. Sometimes it's just listening to other people and seeing, how can I manage, especially with chronic fatigue, it's about how do you manage your energy? And a lot of it is just so basic, but because if you don't know, you don't know. And for me, that is just helping people to feel that joy, that empowerment, feeling that sense of accomplishment for themselves as well, that they've been able to reach their goals. Because I tell you, we all want to be somewhere. We all want to thrive. We all want to be our best self. For me, that's what, making that impact and helping people to be their best self, that has been crucial. And for me, I'm so proud of it.
Adeshola, I love it. Adeshola, if you could have a direct line to our Prime Minister or our government, what would you ask them to change?
What I will ask them to change is make a better, more accessible, better accessible environment, world for everyone. And I think it starts with asking people with lived experience, what are those things that you think will make life better? Because a lot of the conversation don't involve people with disability. They just make a lot of, changes without consulting people with disability. It happens in organizations as well. We get that. For me, I would say making accessible things, because we never know what can happen. If we make the things that are more accessible, be it roads, be it as much as it could be as lighting, simple as lighting. Because I went to with one of my colleagues with a disability who was partially sighted, and the lighting was poor. Those little things, changing the language as well, helping people to understand better the language, helping providing more, and I think financial support for disability, because a lot of people with disability are losing the funding that could be supporting the PIP. All of a sudden, a lot of them are losing their support and being forced into work. But I think the government need to listen, because without listening, then they don't know how they can support people. They don't know how these people are being impacted, and lives are being impacted. It's just about, okay, we need to reduce costs, but then at what cost to other people? Because we need to make sure everyone, in the whole of the United Kingdom feel a sense of belonging, feeling catered for, feeling that they're not a nuisance in the community. And I think at the moment, that's what disabled people feel, that they're a nuisance, and we don't want that. We need to change that narrative.
Adeshola, so what are your plans and goals this year and beyond?
So my plans and goals is to extend my disability podcast. As I said, I'm going to do the disability podcast to reach as many people as possible, because for me, I think we need to grow. We need to help more people to have that understanding of disability and support understanding as well of our community, what disability looks like, because it's not always just a look. There are different forms of disability. Again, as I said, people with invisible disability, you don't see it, but it's there. So helping people to better understand that, to better understand how they can support them. Again, is continuing my disability advocacy work, extending it. As I said, I want it to be global, so I'm working towards that, which is one of the things. I'm part of Divers with Disability, which is international, and what they're doing as well is reaching people. Initially, they're supporting people with visible disability. When I reached out to them and started speaking to them, now they're supporting people with visible disability as well. So that's, of course, it's getting to that stage of global. But I mean, more globally, because there's still some countries where they don't have the support. they need, and disability is still frowned upon, or people with disability are just shut down. They're not allowed to go into the education system. They're not allowed to have the rights health care that they need. And I think that is a big challenge, because they shouldn't feel that they're not part of society. They're humans. They're part of society. As I said, their disability doesn't limit them. Give them that chance, and people with disability will prove to you they're more committed, they're more dedicated, they can give even much more. And that's why when I heard the people with disability, they contribute even much more, because they don't want to be off sick. If you give them the resources to help them, productivity improves significantly. So why not?
Adeshola, thank you. I think this is a brilliant way to end, because it's so true that if we include all the people and we make it possible for them to contribute, the output is so much better, and that is a win-win for everybody. So I'm so grateful for you to come on SheCan to tell your story, for listening and learning all your life on how to access services for you to thrive personally and professionally, and you are, and it's palpable. And thank you so much for the incredible difference that you're making, both in your workplace and out of your workplace.
Thank you so much for having me. It was lovely speaking to you.